Hi everyone, and welcome to another interview today. I'm talking to the lovely Angie Alt, and it's a pleasure to talk to Angie because Angie's cookbook was one of the first autoimmune paleo books that I ever bought, and I really loved it at a time when I was desperate looking for recipes. So I'll tell you a little bit about Angie before we get started. Angie Alt of Autoimmune Paleo is a certified health coach who leads group coaching programs as well as working one-on-one with a small number of highly motivated clients through TPM consulting. She is the author in book, The Alternative Autoimmune Cookbook, Eating for All Phases of the Paleo Autoimmune Protocol, as well as the designer and director of the very popular group health coaching program, SAD to AIP in 6. So Angie, thank you so much for joining me today. I really appreciate having you on the program.
Oh, thanks so much. It's great to be here, Carrie. I really appreciate it. Thanks for inviting me.
Fantastic. So we'll get into the first question. And I know, sorry, I've missed that one. That's all right. What autoimmune diseases do you have, Angie? And what has your journey been to where you are now?
So I have 3 autoimmune diseases. I have celiac disease, endometriosis, and lichen sclerosis. Endometriosis is one of those diseases that's on the suspected autoimmune list. So there's not quite enough clarity in the research at this time to classify it as certainly autoimmune. But I tend to operate on the if it quacks like a duck rule. And endometriosis feels very much like an autoimmune disease to me, compared with my other 2 confirmed autoimmunes. My journey with them, it started with my diagnosis of lichen sclerosis, which happened when I was 21 years old, a few months after I gave birth to my daughter. So it's really common for women to first have their experience with an autoimmune disease at some key point of hormonal fluctuation in their life. So this might be puberty, pregnancy, or perimenopause or menopause. So for me, it was pregnancy. And after my daughter was born, I noticed some changes to my skin. And in those days, we didn't rely on Dr. Google. We didn't have the WebMD, right? So I went to a medical encyclopedia, actually, and I looked up what I was going through, and I found lichen sclerosis, and I went and saw my doctor, and I said, I think that this might be wrong with my skin. And he did an exam, and he confirmed the diagnosis. He said, yes, you're right. You have lichen sclerosis. And he gave me some steroid cream and sent me on my way. And he didn't tell me it was an autoimmune disease. And I certainly didn't understand that that could mean I was now set up for this kind of continuing autoimmune cascade to happen. So, a few months later, I developed some other symptoms that I now know were the first signs of celiac disease. But at the time, I didn't really know that. And I saw my general practitioner, and she said, oh, you just have IBS. It was really dismissed as irritable bowel syndrome. I think, if I remember correctly, something like 8 to 10% of celiacs, their first misdiagnosis is IBS. And I'm one of those people. So I just kind of put up with symptoms, and at times they were more mild and at times they were worse, but it kind of built an intensity. And then about 4 years ago, little over 4 years ago, I got very sick. And my family and I were living overseas in West Africa at the time. I was evacuated. I came home to the United States, and I went through surgery, and my endometriosis was confirmed. I recovered from that surgery, and we returned to life in West Africa, and I didn't really get well. I kept getting sicker. And I started to have a lot of crazy, seemingly kind of unexplained symptoms that I now know were malnourishment from the celiac disease kind of destroying my small intestine. And so I went through some more medical evacuations, a lot of craziness and stress and intensity, but I made it back to the United States, and I kind of made it my mission to find out what was wrong. And I just saw doctor after doctor after doctor. And finally, I was referred to a gastroenterologist who told me that she suspected I had ulcers, but she wanted to run this blood test. And she didn't tell me what the blood test was, but it was a gluten antibody test. And it came back positive. And then I had an endoscopy and took biopsies of my small intestine. And when I woke up from that, she ended over a decade of confusion and suffering for me in about 10 seconds and said, "You have celiac disease." That was it. That was what it was like.
And that was an diagnosis that I have, but I suspect, looking back, the celiac was probably my first autoimmune disease that led to the thyroid issues and the other autoimmune disease that I have. So if you look sort of back on your history, knowing what you know now, and we know that sometimes, you know, autoimmune disease can be brewing for decades, does it make sense to you in any ways why you might have felt a little bit different, or you might have had a few little niggling health issues as a child or into your teens?
You know, well, one of the things about, you know, autoimmune disease, celiac disease in particular, you know, you have to have a genetic susceptibility, and then something flips that switch, right? And I actually think that I lived a relatively healthy life as a kid. I didn't have a lot of health trouble as a kid. And even into my teens, you know, after I went through puberty, I did have some pain and some problems with endometriosis. But I didn't have kind of the more wider autoimmune types of symptoms and kind of nagging illness until after my daughter was born. And I think pregnancy was one of the factors that turned on that switch for me. But that time in between having my daughter and actually being diagnosed, which was about 11 years, a little over a decade. Now, when I look back, I can certainly say, oh yeah, that I've had that problem because I had celiac disease, or I was struggling with this issue because of celiac disease, you know.
And looking healthy, I know, because you look really fit and vibrant and healthy. As you know, I look healthier than I've ever been in my life. So looking healthy but having an invisible illness can bring up a whole lot of emotional challenges. So Angie, what do you deal with now that you didn't before, and how have you had to adapt your life?
Yeah, there's a lot of emotional challenges that go with the invisible illness thing, right? When I was still really sick and not yet diagnosed, one of the big ones for me as a celiac was that I had lost so much weight and that I continued to lose weight. It got to the point that I was losing muscle mass. It wasn't just like fat. But I also experienced some pretty extreme stuff like fat atrophy. So for instance, on my hips, it was like I had these big dents in my hips, and I had dents above my breasts where the fat layer underneath my skin tissue had basically disintegrated. But outwardly, with my clothing on, nobody could tell that. And they just knew that I was really thin, and I got a lot of I would say prejudice, maybe, that I had an eating disorder. You know, this was something I had to battle with a lot with my doctors and even some family and friends who suspected that was my problem. And that wasn't part of my picture, but I felt that I always had to defend that, which is a awful position to be in. Now, I realize that what I have to do is not make the illness my identity, but also advocate for myself and be a clear communicator. Let the people around me that are important to me and need to know that whether or not they can see it and whether or not I appear to be unhealthy to them, that, you know, I'm dealing with these diseases, and I'm working hard to manage them every day, even though to them it appears everything is just fine.
Yeah, and that's absolutely the struggle, isn't it? You've got to have that ongoing negotiation. I think particularly with the people who are closest to you sometimes, because they sort of forget, because you seem to be coping so well and you seem to be doing so well, and you know, you're motoring along, and then you'll have a flare or something like that, and it's like, oh, okay. Yeah. You know, particularly with my youngest son who lives with me, I've got to often say, come on, Jake, you know, Mum's struggling at the moment. I know I look okay, but I'm really not. So I just need you to step up a little bit and, you know, help me do things. So it's just that constant raising it, isn't it? And did you find you had to become more assertive?
Yeah, definitely. I definitely had to learn how to be assertive. I had to learn the difference between, you know, or walking the line of, you know, being overly pushy and commanding, but also being clear about what my needs were, and learning how to communicate that well and concretely. Yeah, I'm a much more assertive person than I was before.
And it's such an important skill, isn't it? And I know a lot of people really struggle with that, particularly when it comes to doctors and dealing with the medical profession. And having chronic autoimmune diseases, or any chronic disease, whether you're diagnosed or not, means that there's a lot more interaction with doctors and the medical community. What was the biggest issue for you, Angie, when you were dealing with the doctors? And knowing what you know now, would you have done anything differently?
I think my biggest struggle was, you know, I kind of mentioned one just a few moments ago, that, you know, some of my doctors didn't take me seriously about the weight loss that I was experiencing, or they thought it was self-inflicted through an eating disorder. Another really big one, especially late in my disease, you know, the more malnourished I got, I started to struggle a lot with mental and emotional health issues, because I didn't have the nutrients I needed to kind of be stable. I was really, really depressed. I had really severe anxiety, panic attacks, things like that going on. You know, it was, if I had been, you know, a mildly anxious person before, about as anxious as any other person, it had been turned up 10 times by that point. And I knew it was really abnormal and not my true kind of setting. And I would try to talk to my doctors about it, and they would say, oh, well, you just need to take an antidepressant, and here's some anti-anxiety medications. And they just wanted to throw prescriptions at me. And I kept trying to say, no, there's something wrong underneath, you know, like this isn't just, I'm not just simply depressed and need a pill. There's something, you know, physically wrong here. And I want to find out what it is so I can correct it. And so that was really hard. It was a really difficult place to advocate from. And if I would, you know, if I would say, well, if I would try to go through the list of things that were wrong, right, they would think, oh, she's just a very anxious, like complaining, hypochondriac type of person. And I would say, no, like these are the components of what's happening here. That was a really big struggle. In hindsight, would I do anything differently knowing what I know now? Yeah, I would probably try to, I mean, I didn't have the advantage of knowing what was happening so that I could inform myself about it and kind of go in empowered with knowledge. But if I could go back to that time and know that it was celiac disease, I would learn everything I could about it and go in really empowered. I think the very first thing that an autoimmune patient needs is empowerment.
Mm-hmm. You're absolutely right. And that information is so powerful to have when you can really understand what's going on. And I know for me, I had all of that anxiety and the brain fog. And, you know, as we saw at the start of this interview, I still get the brain fog. So it's like, you know, the brain just stops and you've got to wait for it to reboot again. And for what was happening for me as somebody, you know, who works with clients and as a therapist and, you know, has been a researcher and all of those things, internally watching what was going on with my mind was the scariest thing, because I had this out of control anxiety. It was nothing like normal anxiety. It was just, there was nothing I could do about it. And I work with anxiety, you know, the depression, I couldn't speak properly. I couldn't articulate sentences. And I knew there was something going on with my mind, and that was more my identity than my body. And that's a really scary place to be in.
Yeah,
And
definitely.
so I think, and a lot of people with an autoimmune disease don't understand that it does have that effect on the mind and the emotions and the anxiety and the depression, that it's not actually a mental thing, it's a biologically driven thing as a factor of the disease itself. And doctors don't recognize that either.
Yeah, it was that was probably one of my biggest struggles, a real source of frustration, and after a while, shame. I started to doubt myself. I started to think, okay, well, they're not finding a physical diagnosis, and so maybe I'm like losing my mind. You know, I was at the time working with a psychiatrist and a psychologist, and we started making plans to maybe admit myself for a short stay in a mental health facility, because I was just really having a hard time coping, but I couldn't, you know, we weren't getting a diagnosis. So I thought, well, maybe I am losing it, and they're right. And thankfully, we started having that conversation, and a few weeks later, I was diagnosed.
And it's such a relief, isn't it, to actually know that there's something, because it actually gives you something to work against, and that you can plan to do something about.
Right. Yeah. I think oh, go ahead.
No, you go.
I was just going to say that I think a lot of autoimmune patients receiving their diagnosis, although there might be some grief to process in that, I think a lot of us come to that actually with relief. I remember I cried pretty hard when the doctor gave me a diagnosis, but it wasn't because I was, thinking at that very moment how I was going to give up like bread and cake and beer. I was crying because I knew for that whole time that something was wrong, and I finally had an answer.
It's that validation, isn't it? Like, yes, I was right. There is something really wrong with me.
Yeah.
And having these sorts of diseases can add so many challenges to the ways that we feel and relate to our bodies. And I know a lot of people sort of express the fact that they feel like their bodies have betrayed them. So did having your autoimmune diseases, Angie, change the way that you see your body and your relationship to it? Has that changed over time?
Yeah. I distinctly remember having the feeling that my body was betraying me, that my body didn't work the way I wanted to. Now, I would say that I feel a lot differently. I feel most of the time extremely grateful for my body. I realize I've learned so much in the interim I really understand that it is miraculous that it functions and that it does all the things that it does. I feel a much greater sense of appreciation. At the point when I got diagnosed, I was so sick and so malnourished. I really didn't think it was that inconceivable that I might die. To know that my body can repair from that point makes me extremely grateful for my body. But that's not to say that I'm like, a perfect Zen master about it either. There's definitely times when I'm, frustrated, and I'm feeling that, my mind is capable of one thing, but my body is not quite there. My body is struggling under the weight of autoimmunity, struggling well, but struggling under the weight of autoimmunity. And there are moments when I'm really frustrated. I'm sure my husband could fill you in on those moments.
Absolutely. And stress can play a huge part in how well we feel. And I found this out myself over the last few months when, something external or unexpected can happen, or just those day-to-day frustrations. So have you made any changes in your personal or your work life to reduce your stress? And do you have any stress reduction tips that you could share with everyone?
Yeah, I definitely made changes to my life to try to reduce stress. I did that I tried to make those changes pretty early on, but the longer I've been in this healing community, and the more I learn, the more I realize how important it is, you know, that what a big role it plays. So I try harder and harder. One of the things I did was really take the leap and do what I wanted to do for a living. Try to really find out what was my calling and answer it. That reduced a lot of stress for me. It made my work life much more rewarding. And for me personally, that leap meant working for myself. So it made it allowed me to control my schedule in a way that was better for stress. You know, I could manage things a little bit differently that way. In terms of like active stress management techniques that I use right now, I like to color. I do adult coloring sometimes. I've dabbled off and on over the last year trying to learn how to play the banjo, do something a little bit musical and low key. I pray, and I'm really big on gratitude. So I try to practice gratitude really consciously. I do something called shout outs all the time. I publicly thank people or let them know how important they are to me, and or, you know, describe ways that they're making my life, you know, they're impacting my life really positively. I really feel like the practice of gratitude is huge in stress reduction. It helps you focus your energy away from what's going wrong and think about what's going right.
No, absolutely. And it's part of having that well-rounded life, isn't it? Now, how did you actually get into like the recipe development and coming up with the idea for the cookbook? Have you always been interested in cooking, or?
Yeah, well, you know, I grew up very, very rural in a kind of rural state in the U.S. in Montana, and my family and I basically lived homestead style. So I've always known about cooking and cooking whole foods, and it was a big part of what my grandmother and my mother taught me how to do. And so cooking seemed really natural and easy. And then when we went overseas as a family to West Africa, you know, the easy, convenience products that are easy to find here are not easy to find there. And I had to really even further refine my cooking skills because I had to do so much from scratch. So by the time I came back to the US and got diagnosed and realized that I needed to make this huge dietary change, that part of the process was relatively easy for me because I had had so much experience cooking. And from there, you know, I just started to, you know, play with adapting recipes, and I started to kind of build up this arsenal of recipes. And my partner and friend, Mickey Trescott, the amazing author of the very first ever AIP cookbook, said to me, you know, you should write a book. And I said, oh, you know, whatever. And she said, no, you should write a book. You should do it. And she really pushed me. Mickey likes to push. So I did it. I wrote a book.
It's fantastic. And thank you for writing the book, because it really helped me, and I'm sure it's helped a lot of other people. And I think one of the things that I try and do when you talk about gratitude, particularly with my family, is I try and focus on all the really good things, or the things that have opened up for me as a process of becoming chronically ill. And food is the big one of those sort of things. And so I really try and focus on, wow, look at all these great recipes. And when I've got the family coming for dinner tonight, as they do every Wednesday night, and so I make them an AIP meal, and they all love it. And it's just really nice to know that you're giving your family this fantastic healthy food, and that tastes really good and everybody enjoys. So it's one of the things, I guess, that I'm grateful for my own illness, that it brought me to this new way of eating and a new way of cooking, and something that actually makes me feel good. So yeah, it's a powerful thing. All the interesting things you never would have thought of would come out of getting sick.
Yeah, definitely not. Because of this, this commonality of this healing diet of AIP, you know, I have a whole new community of people. I eat a whole new kind of diet, a lot more variety of foods than I ate in the past. I also think that, you know, I know in the beginning when you're making the transition, there can be some mourning about some of the former foods that you're letting go. But trust me, for everybody out there who's new to this, you will come to a point where you might actually enjoy your food more and love what you eat more now than you did before. And I'm definitely there.
Mm. No, absolutely. And I think because of my celiac and Hashimoto's gave me weight issues from a very young age. So I developed through the diet culture this really unhealthy relationship with food. So there was a lot of binge eating, there was a lot of sugar, and then there'd be the diets and the deprivation and all that sort of thing. And like I struggled with that all of my life up until about 3 years ago when I decided I was just going to eat intuitively. But going on the AIP and giving up all the processed foods and things, I have no issues with food anymore. Like I eat when I'm hungry, and apart from thinking about food preparation, there's no thought of food. And for someone who found food as this obsessive, almost constant thought in their mind, like, you know, what can I eat for breakfast? What can I eat for lunch? You know, what can I have? Because diets teach deprivation. It completely has transformed my relationship with food. So there's no cravings, there's no feelings of addiction. It feels like a really normal, relaxed relationship with something that was so powerful through all of my life. So it's pretty amazing.
I love that. I love that you had that experience. I mean, that's the power of being nourished.
Absolutely. And a large part of mindset for chronic illness is that process of acceptance. So, Angie, how have you come to terms with your life now, and what advice about acceptance would you like to share?
You know, I think anybody who has my cookbook will see that I think that this is a process just like the grieving process. You know, I describe it that way in my book, and I describe, you know, not only the stages of grief as you move through illness, but there's also some grieving that goes along with healing. And I think, you know, my advice would be to give yourself time to go through those phases and stages, and recognize they're not linear. There might be some back and forth movement in them, some ups and downs in those stages. And just, yeah, give yourself permission to feel them. You know, I for instance, went through the mourning of foods that I used to love that I am not going to ever eat again. As a celiac, I'm never going to have beer again, but I used to love beer. So, you know, I went through a process of mourning that. And I think just giving yourself space to do that is a really important part of the acceptance bit. And then once you kind of get there and you're pretty comfortably in that final point of acceptance, I think it's really important to start working on reframing. Start really actively trying to view the disadvantages of your disease through a new lens, and maybe see the ways that it's actually advantaging you and improving your life maybe. And that can be really hard. And I'm sure that there are, you know, some people watching this right now who think they might even be a little angry at me for saying that there's any advantage to having an autoimmune disease. And I certainly understand that. I'm not saying that you're going to become best friends with your disease and just love it. I don't love having celiac disease or any of my other diseases, but I'm grateful for the positive ways my life has changed because of that. And I can see those now.
And it's really, I mean, for me, I've always been the sort of person that you're in a situation and you go through the emotions of that situation, whether it's grief or anger or any of those different sorts of things. But once you move through it, it's sort of like, well, I'm here where I am. How can I make the best of it? Like, how can I make this the best possible situation for me?
Right.
And that's a constant ongoing process. And I think it's just like normal life. It's just the ups and downs of normal life. You've just got a few little additional things thrown in. So I think, yeah, definitely everybody has to really sort of say, okay, this sucks, go through that anger stage. I don't want to have this. You can go through the denial and just, say, I'm not going to pay any attention. I'm not going to let this be part of my life. I'm just going to go on. I'm going to overcome it. But you'll eventually come to a point where you have to deal with it. Yeah. And when you get to that point, it's got to be about, how is this going to be the best possible thing for me?
Yeah, I mean, when you're in the worst of it, of course, it would be a very rare and a unique individual that would be able to say, in the middle of the most miserable part of the journey, oh, this is really good for me, and I see how it's going to make my life better. Nobody's like that. That's not normal. But once you work through it, if you can try to view it through that new lens, I think it's a huge part of having a really positive and healthy recovery and having a really great and full life. When I look at it now, I realize that going through all of this was preparing me to do what I do now as a health coach, and preparing me to work with people nutritionally and to answer my calling.
Absolutely. And, getting the chance to talk about illnesses and raising awareness and letting people know that, it's not just a disease of the body. It affects the mind, it affects the emotions, it affects your relationships, it affects everything. And I think the more we have people talking about their honest experiences, and the more it helps those people who are just the ones wandering from doctor to doctor looking for a solution. And it gives you that power back, so you can start to think, okay, I've got this, that I can still control so much, like there's so much power I can still bring to this that can make myself feel better and make my life feel better regardless of the situation that I'm in. And that's, yeah, if you can connect to that, that really, really helps.
Yeah, I think it's key.
One of the most difficult and frustrating things about having an autoimmune disease that I found is trying to get your partner or your friends or family to understand what you're going through and any limitations that you might have. So has your autoimmune disease changed your relationships? And were there any people or relationships you had to let go of for your own peace of mind?
I mean, it definitely impacted my relationships. I would be lying to say it didn't. There's no way it can't. It definitely did. That I can think of. And we had to kind of have a new paradigm in that relationship. Obviously, most specifically for me, that's with my husband and my daughter, especially my husband. He had gone through the worst of it with me, and at moments thought maybe I was going to die, but we also couldn't get answers. And we had planned to live quite a long time, 10 years or more in Africa. And we had to completely change that plan for our family after only 3 years, after working for that goal for the previous 4 years and having so yeah, all of that was really hard. But learning to communicate about it better was really positive. And again, this is the, trying to reframe and look back and whatever, it actually really strengthened our marriage. And being so open and honest, and for me, learning how to ask for support in clear and defined ways, and for him, learning how to support a person who is sick without looking sick, actually really made our marriage Did I lose you, Carrie?
Yes, it went a little bit wonky there.
Okay, you're back then.
Missed the last bit of that. Yeah. I got up to you when you were just saying that for your husband having to care for you with a person who didn't look sick, that it ultimately ended up strengthening your relationship, because it is really hard. And I know, particularly for me at one point, because I was so sick, and I could have gone into a coma, I could have died, and had heart failure and all those different sorts of things, and I couldn't do anything. So it really changed my perspective. So going from the person who was the one who was always looking after people, and the strong one, and the capable one, and the planner, and because I'm a single parent, so I'm also the sole earner, and not being able to work, and then being in a position where you think, if anything happens to me, what's going to happen to my family? Or if I can't work, what's going to happen to where we live, and where are we going to do, what are we going to do? It really puts you in that position where you've got having some really open, in a lot of my relationships got better and deeper and more honest. And me being willing to be vulnerable, which was a really scary thing for me to do as an ex-control freak, giving people the opportunity to support you, I think, is one of the most powerful things you can do. It's also the most scary thing you can do. But when you can put yourself in that position where you say, I need help, you can often be incredibly surprised and gratified at how many people really do want to step up and help you.
Yeah, I mean, that it's hard to kind of maybe be that brave and say, you know what, I am ill to the point that I need care. For especially for moms, I think for we moms, I think that's hard to be there, because we're usually the carer, the caretaker, instead of the one being cared for. But yeah, in most cases, I found that my relationships were actually strengthened when I was clear and honest about everything. And now the ways that my life has changed, for instance, how I eat, to try to support my wellness, as long as I'm just clear, I get nothing but support and respect from the people around me to support my health.
And you're right. It's about you being clear, and I think that's part of that assertiveness. And I think it's really important for people to understand that you've got to stand up for you, and you've got to advocate for you, and it's not selfish. A lot of people, I think, feel that people are going to think that they're selfish, or they want everything their own way, but it's not selfish. It's self-care, and it's really essential, because the more that I look after myself, the better that I function, the more I can help my family, the more I can help, I can be there for my friends, the more I can help my clients. So, but if I don't look after me, I'm not going to be capable of doing anything. And in fact, I'm going to become a burden if I don't look after me. So I think people have really got to get that idea of being selfish or self-centered out of their head. The more you invest in yourself, the more you're going to have to give to everybody else in your life.
Right. With my clients, we call this the plane crash scenario. I say, if the plane is going down, and you being very sick right now and incapacitated is the equivalent of the plane going down, you have to put on your oxygen mask before you can put on the oxygen masks of your loved ones sitting next to you. If you don't do that, you're both going to die. And that really helps my clients get clarity about it. Suddenly they see, okay, and then from then on, every time we have if
Sorry
Way
that
back.
we're,
Yeah.
we've got a really bad connection, which is so unfortunate because it's been chopping off some really important things that you've had to say. But yeah, that's absolutely right. If you have that analogy, like the plane crash, which is a really great metaphor to use, that's how important it is. You
Yep.
know, it is life or death. If you
Yep.
don't do something to help yourself, everything else is going to crash.
Yep. Yep.
And that's only going to make you feel worse watching it happen. I mean, in my situation, if I hadn't been able to do something about my health, my son probably would have had to go and live with his father. And the worst case scenario we were planning for is that was what would happen. You know, he would have to go and live with his father. I would have to go and live with my father. I would have to give up my rental property. I would have to give up my business. And when you're looking at that sort of situation, that is plane crash. That is life or death. And try and look after yourself. So I'm just checking if you can hear me before I ask the last couple of questions.
Yeah, I can hear you again, Carrie.
Fantastic. So Angie, what advice would you give the partner and family of someone with a newly diagnosed autoimmune disease?
I would say have some patience. You know, this person is ill, and they need some time to recover, and they need time to kind of adjust their paradigm for themselves. I would say get support for yourselves. So having a person who has autoimmune disease and is still in the beginning of trying to learn how to manage it and recover their health somewhat, it might be quite a heavy load for their family members around them. The person with autoimmune disease should try to be, a little bit aware of that and spread their needs out amongst their whole, support network, and not just expect one or two family members to take it all on. But the family members themselves should probably look for support, a place for them to vent or get help while they care for that person. And then I would say,
Yes, that connection went south again. So you were saying that it's really important for the partner to have connection and support, and I agree with that. I think it can totally change the dynamics of a relationship and the responsibilities. And during that initial really chronic phase, it is hard on the people. It's hard on any carer. I mean, we know in situations where people who are permanent carers, there is such a thing as carer burnout,
right.
Where you just get exhausted and overwhelmed. And so it's really important for anybody in that relationship to make sure their needs met as well, so they can come back into their relationship feeling, refreshed and with some energy and getting some support, because there can be things you don't want to say to your partner and how you're feeling when they're sick, but you really need to say anyway. And it's really important, I think, that people are able to have someone to talk to where they can get out that stuff.
Right.
And then, go back into the relationship feeling better about it.
Yeah, refresh.
If there was one thing, Angie, you've done that's made the biggest difference to your life and how you feel now, what would that be?
Obviously, adopting the AIP, adopting the autoimmune protocol as my primary tool for managing my autoimmune diseases. It was life-changing. Next month, on May 1st, I'll celebrate 4 years of doing that.
Wow.
It has completely changed my life in every way. It changed my career. It changed everything about my life, all for the better. It was, I thought it was a very crazy and kind of a fringe idea when I found it. There was me and Eileen and Mickey and Sarah Ballantyne and Christina Feindel. We were pretty much the only people out there doing it. A friend of ours, Whitney. But I'm so glad that we took the leap and that we did it and that we blogged about it and changed our lives.
And changed hundreds of thousands of people's lives.
And changed a lot of other people's lives.
Yeah.
Yeah.
And that's the whole ripple effect, isn't it? That, you know, just by you doing something and putting it out there. And I know, God, that it saved my life. I mean, literally, when I was so sick, the first thing I did was change to the AIP diet as soon as I found out about it, which was, you know, through you and Mickey and Sarah and all of that. And at that stage, I was like, my TSH was 180 something. I was close to going into a coma. My organs were starting to shut down. And I was on 50, the tiniest dosage of T4 that you could get of thyroxine, Utroxic. I was on the minimum dosage of that. And it wasn't that saved me. It was the diet. It was the diet that kept me alive. It was the diet that started to help me heal. And I needed that energy then to go out and find a doctor who would prescribe me, you know, natural desiccated thyroid and who would partner with me. And if I hadn't have been supported by the diet, I
couldn't have done all that other stuff. Yeah.
No, I probably wouldn't be here. I'd be living at my father's, you know, as a permanent incapacitated person. And it's people like you putting the information out there that gives so many people you'll probably never even meet, because that's the whole thing. You know, most of the time when we change people's lives, we don't even know it. We'll never know it. So if you haven't experienced what you eat until you experience it yourself.
Yeah.
So if people want to work with you, Angie, or they want to know more about what you do, how can they find you?
So I blog with Mickey Truscott, my partner, at autoimmunepaleo.com. That's autoimmune-paleo.com if you're trying to type it into your web browser right now. Our books are there on the website. You can find them. My book is the Alternative Autoimmune Cookbook, like Carrie mentioned. It's available in hardback hard copy and ebook. And I run a group program, SAD to AIP in 6. We enroll about 5 times a year. Enrollment is open right now during April for the May groups. Sometime in the next month, we're going to enroll the 1,000th person who's done this. So that's going to be really exciting. We would love to have you join our group if you'd like. We have lots of folks from Australia. Folks are listening. You are welcome. Yeah, you can find everything about the group on our website.
Fantastic, and I'll put the links up to that when I do the blog post as well. So
awesome. Thanks, Karen.
Thanks again for talking to me. I'm sorry we've had such a crappy connection. It's the first time it's ever happened, but hopefully there's enough gold in there for people to listen along and get that information out there, because I really love everything that you had to say. And thank you so much for doing your cookbook and for doing what you do, because you've helped me and I know that you'll help lots of other people. So
thanks. You're so welcome. And I'm not upset about the connection. It's amazing that we can talk while you're in Australia and I'm in the US.
Yes. Okay. Well, you have a great night, and I'll look forward to bringing another interview to everybody in the very near future. So thanks for watching. And if you like what you're seeing, please share it around so that people can get this valuable information so they can help themselves. Thank you.
Thanks.